besides being the Speaker of the County Assembly, I'm also the Deputy Chair of the County Assembly's Forum. This is the equivalent of the Council of Governors, elected by the MCAs in Kenya, and the Speakers of County Assemblies. What I bring on table with Nzoka Waita is the managerial skills, because my experience from being a speaker has been so close to what devolution is all about. And I've talked about the role I'm playing in the County Assembly's Forum. So everything that I've been doing in the last 5 years is about devolution. I'm well versed with what we need to do development-wise on devolution principles so that we can change our county. Nzoka Waita served in the Safaricom company, a blue chip company, we all know it. He was behind many of these apps that we are using today. M-Pesa, 15 years he served there. And please call me, Okoa Jahazi, and many others. So technologically, he is very, very okay. And we need technology to bring into space the development in this county. If we can do everything, because you also have email. But we do it with it in mind that the human resource in the county is needed just like it is needed in the other parts of the country. Are we together? Yes. I said with those connections from the national government and the international level, and me at devolution, ama mashinani, ikiwa ni dispensary iko Getani. Getani, the problem they have there, have been there. Even the roads. Kwanza hata mama kufika huko. Alafu hakuna dawa kila pahali, kila pahali. Then the working conditions you are in. I must actually say thank you. It's been difficult for you. So what we want to do with Nzoka Waita, with your assistance, and we really appreciate the important role you can play in this process, because by the mercy and the grace of the Lord, Machakos is going to change. It will never be the same again. I can promise you. I can promise you. And so don't be left out, because we need you. We need you to come and tell us, in this dispensary, this is what is needed. And we've tried to do this. We can do it differently, and the Mwananchi will be served. And we are thinking of having medicine right from that. I know there's level 1. But level 1, it is some, I know, the CHVs or the community health workers. That's public health. First, we will strengthen it, because prevention is better than cure. Liberia and those countries of West Africa where there is Ebola, they survived in the corona pandemic because they were used now to using their public health officers. So they never had, they didn't lose many lives like we did here. Ours was just starting. So we say we must empower the public health sector. In fact, we want to call them public health officers, or whichever name you suggest with them, so that then there are people who are on permanent and pensionable employment by the county. Yes. Because when are we going to create jobs? And we said we must create jobs. And if they go to the village, then they are able to attend to those people. Whatever it is, facilitated and trained, they can detect one who is in need of urgent attention. And we have a dispensary nearby. We have a functioning ambulance system, not just Machakos, which have no seats. Then they are able even to save lives. And that way, by the time they come to you now, because you are in a higher level, the patient has already got assistance and a life has been saved. But suffices to say that the dispensaries, the health centers, the level 3s, the level 4s must be well equipped. Medication, equipment, staffing, and all that. But again, we've also decided in Mavoko, we will do a level 6, which is the referral now for the whole county. Our intention is to have no person from Machakos being treated from outside of Machakos. We've talked of of the development partners that are already saying, nyinyi mkipata hii. Niwaambia kuna watu wako na connections. Mkipata hii tutakuja tutawajengea hii, tutaleta hii, tutaleta hii. So with that kind of partnership, we want to start with the first level 6 in Mavoko. Meru, I think they are on the 3rd or 2nd level 6. Alafu, some of us who are also vying for the same seat are talking of making your level 5 a level 4. Our thought is to create level 6 to start with. Mavoko is already identified because of the population, and there is already a CDF institution that was started, and then and what goes on in the 10 years that have passed. Just like many other stalled health facility projects that you know. Yes. So if you go to hospital or health facility, your patients should be able to get all the help they need. And I know as a medical officer, health officer, it pains you to get a patient and you can't assist them because there's no equipment, there's no medicine, and yet the hypocritic also is telling you to save this life. And I know the doctors also have had it so hard. The clinicians who are here have been the ones who have been carrying the yoke, and the nurses, the lab technicians, the what, seeing those desperate cases. We had camps in Mwala, in Matu. Another one is going on now in Chumpi, or tomorrow. And you see the desperation in the peoples who are coming to see you. So we dream big. We want to see how some of you can make some kind of exchange programs with advanced institutions and how you can borrow ideas. And our training, our experience makes us fit to serve the county of Machakos well. So I am appealing to you, where you work. I've also heard others say, Natoka Kagundo, I am now in Mavoko. Where you also come from, please talk to your people. Will you? Yes. Wangapi wamekuwa convinced kwamba watashika mkono sio kama Waita na sisi. Tuko ndani.